Hey guys, it's Dr. Emer, and we're doing one of my favorite things today, male facial sculpting using fillers. We have one of my younger patients that just wants to give a little bit of enhancement to his lip area and around the mouth. Some of my younger patients come in talking about their under eyes, and especially their lip, chin, and mouth corners very frequently in their 20s to 30s. And what I'm noticing lately are these very duck lips, we call the Russian lip, which I think is way overdone. And their lips walk in the room before they do. We don't want that. We just want subtle improvement. We want balancing, facial balancing. So with him, to his upper lip, he really doesn't have a lot. So it's gonna be a little more difficult to give him a full lift without doing a surgical lift or something like a Botox lip flip, but we're gonna work our magic to try and give him a little more lip show and a little elevation. Same thing on the bottom. We really want the lip to kind of balance and come forward while also projecting the chin. The chin gives support to the lip, especially the lower lip. And this area right here, called the lower cutaneous lip, supports the corners of the mouth and the lip. So we're gonna work on the chin and we're gonna work on the lip. So we're gonna start today with a product that gives me a little bit more substance in this area on the chin called Juvéderm Ultra Plus. This will hold a little more volume here and project, but the idea is some sort of width and balancing. So I'm gonna go right on the bone. We're gonna do a little massaging so he doesn't have much pain. And we're gonna kind of spread this across so we can give him a little balancing. Most chins and guys needs a little bit more filler than a syringe, but we'll do a syringe. We can always add more in the future.
They want to know, do you use the same filler for the lip and the chin?
Well, guess what, guys? Today we're not. That's the Ultra Plus, and actually you can see right away a little more width and a little more projection. Ultra Plus is unique because it has the ability to hold more water, which I don't necessarily like in the lip. You don't want the lip to get too swollen, so now we have that projection. So we're gonna switch over to a product that's a little more mobile, a little softer in look, and it's gonna give us a little more sort of shaping for the lip, and that's called Kysse. And so we're gonna just identify the areas we wanna go. We're gonna do some pillar, just gonna do very small amounts at a time. I'm gonna go nice and slow because the lip always hurts. He's had issues in the past with lips causing lumps and bumps, so we're gonna use a softer filler today that typically doesn't do that. And we're gonna balance it properly.
They want to know, what's the pain like?
Hold on, give me 1 second. After a second, hold on. But yes, the pain, it hurts, but he is like champion, literally a champion. But you guys see I'm creating the balancing here. Okay, so now it's balanced. Go ahead, what is the pain like?
It's like pinching. It makes your eyes water a little bit.
So let me take a look. Now the bottom looks much more balanced. We don't want to widen it too much, but I definitely want volume there. But what I love about Kysse is, you know, it's softer, but it still allows me to give a little bit of volume. Okay? All right, perfect. So now let's focus on defining the upper. And actually, in men, we don't always do the pillar here, but we're gonna do that on him because it's gonna support the cupid's bow. So we're gonna define the pillar a little bit. And then I'm gonna go right into the edge of the cupid's bow.
They said it feels like I'm the one in the chair.
Torture. And I just want to balance it. And then we'll go to the other side. You see, we're lifting this area up the best that we can because his lip naturally doesn't want to come up. Okay, grab his tear in his eye, the rosa on one side and the blood. We'll switch over. I'm gonna clean off. I'm gonna let you guys see the one upper lip versus the other. Take a look. You can already see, obviously it gets more swollen, but you can already see elevation here and more volume. So now on this side, we're gonna try and get it to flip up. We're gonna go right again to the edge of the cupid's bow, right there. I'll come by you really quick. We're gonna grab And now we're gonna work on lifting.
He is numb, yeah, he's numb.
So on this side, kind of curls over more. So I'm trying to get it to lift up, doing a pillar technique. Get his eyes, hold on. Close your eyes a sec. Good. Let's let that sit a second. He bleeds easily. It's okay. I'm just gonna let it stop. It's drooling because of the numbing.
Oh, I'm not doing.
It's okay. It's alright, don't worry. It's normal. Again, trying to get the top part to kind of curl up a little bit using a pillar technique. He'll probably want to do a little more. Close again, close.
How long does lip filler last?
This will last him about a year. Most often guys tend to about 9 months, want a little bit more. I usually think, especially in someone like him where we literally had almost no filler, then he might want to leave him a little bit more in a month or so if he needs more, and then you go every year sort of thing. Let's take a look now. A teeny bit if I need. Yeah, that looks much better. All right, so now last little bit, we're gonna go to the midline Cupid's bow, give it a little definition. Same thing on the other side. And I think that's good for a syringe. And we're gonna let it settle, and then we'll do an Emer reveal really quickly. And I'll show you guys what what one syringe can do. The cool thing about Kysse is over the next few weeks, it really transforms the area. And what we did here was try and give him a little more lip show and a little more balancing to the size. So let's reverse and let's show him on the iPhone. Go ahead and grab it and take a look. So take a look with it without the smiling so you can see, what do you think? Much more even. Obviously, you're not gonna be able to speak as much. It's good when you smile. Much more balanced here. There's projection to your chin. If you turn this way, see how the chin now comes forward a little bit and how it balances the nose and the lip. And then even on this side, when you turn that way, look, you have more lip show and it's more elevated. And then what we need to do over the next couple weeks is see how this settles in here. And if we need to keep building, we keep applying it and pushing more in here so it lifts even more. But that's normal. It's soft, it's not rubbery. Now let's show them in the mirror, because that makes a big difference. Harder to tell. Now, what do you think? Better.
Yeah.
And then we're gonna see, Kysse settles over time. In the next couple hours it transforms, and in the next couple weeks it transforms, because it becomes integrated into your own skin. It has a type of technology that moves with you and blends, so it doesn't lump, it doesn't bump, and it rarely causes any complications. So he will be ready to kiss in about 72 hours, but I think his lips look great, and when you smile, look, much more elevation at the Cupid's bow. So I think it's a success. Male facial sculpting around the mouth. Do a quick pan, and we're done. That's good. Honestly, this face from afar. That's way better. It's great.
So how do you like